I decided to have bariatric surgery because I had several health issues. I had high blood pressure, I had high cholesterol, and I was also pre-diabetic. What was really wonderful was that my surgeon, Dr. Veenstra, came in. He explained what I could expect the day of surgery, and he also asked my brother if my brother had any questions, and my brother did have several questions. And what really resonated with me was my brother said to me, you know what, after talking to Dr. Veenstra, you're in great hands.
At Rush, we treat the whole person because we know that surgery isn't just about weight loss. It's also about lifestyle changes that help our patients achieve long-term success. Obesity is a serious condition that affects almost every part of the body. It's a risk factor for heart disease, type 2 diabetes, stroke, and some cancers. Our surgeons have done thousands of bariatric procedures. We're trained in the latest techniques and are accredited by the American College of Surgeons and the American Society for Metabolic and Bariatric Surgery. Most procedures are performed minimally invasively. This involves small incisions for a quicker recovery and less pain postoperatively. Our team approach to weight loss starts with evaluation and guidance from a dietitian, a psychologist, and specialists who address related conditions. The goal is to help you improve your health so that you can live a longer, more fulfilling life.
We talk to each patient about the process so they know what to expect and how to be successful after surgery. We talk a lot about a person's weight history, their emotional functioning, and their relationship with food. It's important to know that weight issues are very complex. People can be overweight for a variety of reasons. Just because somebody is overweight doesn't mean that they have an eating disorder or psychological issues. We take a very individual approach to assessing each patient. Some people habitually overeat, meaning that they regularly use food to cope with their feelings. This can hinder weight loss efforts. We address that through cognitive behavioral treatment.
Honestly, I've had weight issues my whole life. We started in puberty, and then by the time I had my daughter, I was really severely obese, and it just kept getting worse. It really kept me from doing a lot of the things I love to do. I love to run, love to be active in sports. I just couldn't do it. When I met the people at Rush, I knew I was in the right place. They never promised me a quick fix. They took the time to educate me from day one, and they really just gave me a shot at a new life. I go to my support group meetings and follow-up visits with my providers. My blood pressure is normal, my diabetes is gone. It just works.
At Rush, to determine your candidacy for bariatric surgery, we look at your BMI or your body mass index. If your BMI is greater than 40, or if it's greater than 35 with an obesity-related illness, such as high blood pressure, diabetes, or sleep apnea, you may be a good candidate for surgery. The pathway to bariatric surgery includes a variety of tests. It includes blood work, diagnostic imaging. We also set up consultation with our dietitians and psychologists, and you may also need a letter of recommendation from your primary care provider.
The Rush Center for Weight Loss and Lifestyle Medicine is an integral part of this comprehensive weight loss program here at Rush. In fact, we take care of patients whether or not they want surgery, and also post-surgery to keep the weight off long-term. Many centers do not have a long-term structured program for their patients. Here at Rush, we commit for a lifetime. That's what makes us unique.
We work out a weight loss plan for each patient that comes through our program. It's a map they can follow, and it helps with long-term lifestyle change.
Bariatric surgery started more than 40 years ago, but now is more effective, more safe, also tailored toward the needs of our patients. Rush bariatric procedures include laparoscopic gastrectomy, also known as a sleeve, gastric bypass, where the surgeon creates a small pouch that connects to the intestine, bypassing much of the digestive tract. Our surgeons are specialists for this procedure. The outcome can be life-changing for our patients.
Patients often ask us, how can bariatric surgery improve my health? Research shows that people who have this surgery have a lower risk of dying from obesity-related conditions. Weight loss surgery can improve self-esteem, quality of relationships, mobility, and mental health.
I believe that a patient should have surgery for the right reasons. I also truly believe in expectations. When the patient and surgeon have the same postoperative expectations, patients truly have superior outcomes and they're more satisfied. For me, the reward of having a patient embrace wellness and live a healthier lifestyle and going all in with their wellness is key. At Rush, this is our passion.
I had the will and the desire to lose weight, but what I really didn't have was a plan. And at Rush, what I found was I had the plan and I also had the people to help me make it happen.